Back, it is 1:39 on your Tuesday. Next up, we're going out to the burbs. We are talking about a new crisis recovery center. It's opening up. It's going to be 24/7, and we're talking this is going to be helping out people with mental illness, with substance abuse issues. Right now, we're Zooming with the chair of the DuPage County Board, Deborah Conroy. Deborah, can you hear me okay?
I can hear you, yes.
Hi. Okay, and you also have a friend. Who's your friend?
I do. Lori Carnahan is here, and she is the director of the new Crisis Recovery Center.
All right, Lori, thanks for being with us too. We appreciate that. Can you? This is we're opening this, right? This is ready to go, right, for the public.
We are cutting the ribbon tomorrow. Yes.
That's great. Can you just tell me what this is all about?
So the Crisis Recovery Center is our response to someone to call, someone to respond, and now somewhere to go. So we have 988, which is the national hotline for mental health and addiction. Folks who are struggling or are in a crisis. So our challenge has been we haven't had anywhere for folks to go. So this is our answer in DuPage County for somewhere to go. So the facility will treat mental health, addiction and detox, as well as we'll have the first in the country to have a hub for children, which is something we're incredibly proud of.
Lori, where did this, how long has this idea been in the works? I have a feeling this was not an overnight thing.
Yes, it was not an overnight thing. It's been years and years, and really a true collaboration of all of our community partners. So from the county board and our board of health to hospital systems and local providers, it really has been the community coming together and answering the call to we need something different. We need a whole new system of care to help treat people with mental health and substance use crisis in a space that's really dedicated for them.
I've been working in this market for about 10 years, and the heroin epidemic, the fentanyl epidemic, especially, I don't know, 8, 9 years ago, really took off. Can you talk about what's going on out in DuPage County when it comes to substance abuse?
So I was in the General Assembly when that was happening, and it was very clear. We went from the opioid crisis into the fentanyl crisis in the heroin crisis because it was cheaper and easier to get. And it was at that point we started to really see kind of the co-diagnoses of the two, mental health and addiction. And we were really hearing from families that there was nowhere for families to go. If you had a child you were concerned about, you might decide, oh, I don't know what to do. I don't know who to call. Well, if you did find someone to call, you could have to wait 3 to 4 months just to see a doctor.
Right.
And for a child or for an adult, many times we've seen adults who are in crisis that really need that care who would end up in an emergency room, and the care that they need is not there. A continuum of care does not exist through the emergency room. So that's the piece that we're trying to fix. We're trying to make sure that people can come here. It's a beautiful therapeutic environment. They can come and they can begin their journey to wellness, to mental health and crisis and substance use. Wellness again. I mean, it's just like any other disease. We have to treat it with medical care and with a continuum of care. And this Crisis Recovery Center is that piece of mental health and substance use care that's missing.
So, Lori, how does this work? It's open 24/7. So obviously I can walk in the door at any point and get the help I need. Should I think of it as like an inpatient, outpatient, where I come for therapy? What exactly are you going to be offering people?
Yeah, absolutely. So it is a 24/7 facility. So people can walk in or be dropped off 24 hours a day and 7 days a week. And what really makes this unique is there's going to be 3 distinct areas in this building. So one for adults struggling in a mental health crisis, one for youth. So our kids and teens will now have that place to go as well. And then once for adults, an area for adults that is specifically dedicated to sobering and some withdrawal management. So it really allows us to provide intervention, stabilization, support by our crisis counselors, along with people with lived experience, psychiatric nurses. So there's really a whole dedicated team of people that are there to help stabilize that crisis, link to community resources, and make sure they get on their path to recovery.
What are you hearing from the community about this? I have a feeling that it's, sadly it's needed, right? But it's needed, and now it's going to be open, and what a great thing for the community.
Yeah, in the community, whether it's first responders or, folks in education, everyone is just so incredibly thrilled and anxious for this facility to open. You know, in DuPage County, we understand it's okay to not be okay,
Yeah.
but it's not okay to have nowhere to go. And now we have somewhere to go.
When I was doing, when I was really covering the heroin and fentanyl and opioid epidemic, I heard so much about underinsured or uninsured, right? And you would go to the emergency rooms and you were there for a couple of days and then that was it. And then you couldn't afford to go to these treatment places, whereas this is a really good alternative. Do you have to live in DuPage County? If I'm up in Kane County, if I'm over in Will County, can I utilize the service?
So the building is designed for DuPage County residents. However, we know many people visit DuPage County or work in DuPage County. So really, if you are in crisis in DuPage County with a mental health or substance use issue, these services are available to you. And if you don't live here, then we're going to go ahead and link you to your community resource after that crisis is stabilized.
Okay, so the ribbon cutting is tomorrow. I'm sure you guys have put so much hard work into this. It's such a great facility, and I'm sure there's going to be a lot of other neighboring counties, neighboring communities, maybe not even neighboring, but across the nation looking at you guys going, see what they did? We should do that too. So congrats to you guys on this.
Thank you.
Thank you.
Thanks so much, ladies. All right.